I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love animals. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about all of those things. Welcome to the Dr. Molly Says podcast. We have another really fun topic to cover today. Another a little bit controversial topic, which is kind of what we've been doing since we started this. But I think everyone's appreciating that we're talking about these things because sometimes people don't want to talk about these things because they're complicated. So we're going to cover another topic today, and that is timing of spay and neuter for dogs and cats. So I'm excited to talk about it. It's something I talk about in clinic a lot. It's something a lot of pet owners are wanting to know about. It's something I get questions about on social media all the time. So I'm hoping to give you some more clarity on making that decision. But before we talk about the topic this week, I have news for y'all. So we had some real drama at our house this weekend. So if you haven't heard me talk about my chickens, Ryan and I have chickens, okay? We got 6 chickens just over a year ago at our house. We live in a very suburban neighborhood, and we ordered chickens from mypetchicken.com. We got a smart coop from the company Smart Coop. It's a very cool chicken coop, and we have had chickens for a year. We got them as day-old chicks, 6 to start with. Over the first 6 to 7 months, we lost 2 of the chickens. Very sad. They all have names. They all have old lady names. And so a few months ago, 3 months ago, we had lost 2 chickens and we wanted to replace them. So instead of getting day-old chicks, we got fully grown hens from a friend of mine who's also a veterinary client of mine, Jackie. She has a farm with sheep and she has lots and lots of chickens. So she's like, don't raise chicks, just come to my place and get you a couple chickens. So we go to her farm. She has caught us 2 hens. These are Polish cross, very cool looking hens, but they're feral, okay? Straight up feral. They have no regard for humans. They've probably never been touched by a human before. Meanwhile, our 4 other chickens are like pets. They're like dogs. They waddle around, follow me around, and come when my car pulls in and want me to pet them, okay? So no, we got these 2 feral chickens. We named them Thelma and Louise because they're crazy, and we tried to integrate them into our flock, which that part went okay, but we have neighbors next door who have a lot of chickens and a rooster. And what happened is we have our smaller coop, and then we have a chicken area that's fenced off in the back of our yard. And so our 2 new chickens, Thelma and Louise, during the day, they would escape from our chicken fenced off area and wander over to the neighbors and different parts of the neighborhood, which there are several people in our neighborhood that have chickens. So that's not that weird. But anyway, they've been wandering. Okay. And about 3 weeks ago, they both sort of disappeared, didn't come home one night. And so we were like, well, maybe something happened to them. So we kind of looked for them, couldn't find them. We thought maybe a predator got them. We have hawks and foxes and other predators around. So that's kind of what we had decided. They just had gotten got by a predator. No. We were very wrong. So on Saturday, this past weekend, Ryan calls me. I'm on my way home from Knoxville. I had gone to UT vet school graduation. He's like, I just found something very interesting in the yard. I'm like, oh no, did something happen to one of our 4 chickens? He's like, no. He's like, Thelma, we thought she was gone. She's not gone. She's been living in our front landscaping for the last 3 weeks, apparently, protecting her clutch of fertilized eggs that she's laid. And they're hatching. And so he found Thelma with 4 baby chicks, running around, peeping around her, and about, 18 eggs underneath her, all ready to hatch. So turns out Thelma's been having conjugal visits with the rooster next door probably, and he's been fertilizing eggs, and she's been laying them under this giant, very well-hidden bush on our front lawn's landscaping. Our house is not big. I don't know. She just was hiding very well there. It's right next to our front door. And she yeah, so she's been sitting on those eggs. So we think she's been like sneaking over early in the morning to the neighbors to like maybe get a snack and some water and then just sitting on her eggs all day, which is why we didn't see her. And so he found 4 baby chicks and a bunch of eggs, and a couple eggs are already actively hatching. So we moved everybody into a big giant water trough tub. And so now we have Mom, Thelma, and she now has 7 live baby chicks with her. They're in our living room in this big giant tub. And there are 10 eggs now underneath her that appear to have embryos in them. So if they're going to hatch, it's probably going to happen in the next couple of days. So we're going to see what happens. So anyway, just life update. That's what's been happening at our house. If you missed it on social media, feel free to go watch the saga unfold in my stories. I will highlight them, and I need to make a reel of the chicken saga. So anyway, we are the proud grandparents of a bunch of baby chicks right now who are going to have to find very good homes very soon. So that's what's been happening at our house. I don't know about you, but I don't know if you have kids, if you're a parent and you have children and it's May. All of my condolences to the craziness that is May. It is not a marathon, it is a sprint, and the month of May is insane. But it is almost over. I'm very glad for that. Hence why I'm still in my scrubs at 10 p.m. right now. I also have a hot take. I have a hot take. All right. Hot takes over hot tea, except I'm not drinking hot tea because it's warm outside. Here's my hot take. For the most part, otherwise healthy dogs and cats will drink when they need to drink water, and they will eat when they need to eat. I have found myself having this conversation with several clients lately, which is okay, but I just every time I have this conversation, I think you should say this to the people. Water especially. I do have clients who get very concerned about their pets drinking enough water. This usually happens after we've had some kind of illness or treatment or procedure, and that pet is being watched more than they normally are, and their people become, I don't know, sometimes very obsessed with how much water they're drinking. And I think that sometimes it's just like something objective that people can measure or think about, but it can become a little silly because, like, for example, sometimes what happens when I do dentals on dogs, if I have to do oral surgery, I take teeth out, we put suture in their mouth, I'll have the owners feed them wet food instead of dry food if they're used to eating crunchy dry food. And so I'll have owners actually soak their kibble in water if they don't want to buy canned food. But either way, they're used to eating dry kibble, and then they switch to eating, sorry, I'm yawning, and they switch to eating like dry kibble that's soaked in water or a canned food. That's a lot more moisture that they're taking in with their food. And so they're getting a lot of their daily water from their food source. So they're going to feel less thirsty, and they're going to drink less just free liquid water than they normally do. And so if you're a pet owner and something like that's going on and you notice that makes sense. That's okay. They're getting more moisture in their food. They're going to need to drink less water. They're pretty good at regulating that. And I often tell people I just have never really seen an otherwise healthy pet make themselves dehydrated just because they are choosing not to drink water, or make themselves sick by not eating just because of a feeling. Usually dogs and cats are not eating because something hurts. They're sick in some way. I hope this makes sense. Basically, the hot take is if your pet is not actively sick, they'll eat when they need to eat and drink when they need to drink. Now, all of that to say, I am very much in support of meal feeding your pets. So I do think that, or for dogs especially, it's a good idea to offer them a meal and then take that away if they don't eat it, so that they're not necessarily free range eating all day. Or you are the sole source of their food and they eat it throughout the day. So you keep all of their food on you and you give it to them throughout the day as a reward. So those are the 2 ways of eating I like for my clients to provide for their dog. It helps us keep an idea of what their appetite actually is. Because if they're free grazing, eating, it's hard to know how much they really are eating. So anyway, that wasn't the hot take, but that is how I feel about that. But the hot take is try not to obsess about how much water your dog is drinking. If they are drinking water and they're acting fine and they're not sick. And for the love, please do not force feed your dog or your cat water with a syringe if they are otherwise healthy and a veterinarian has not asked you to do that. Don't do that. You can cause them to aspirate water into their lungs and they can get fatal pneumonia. So you really don't need to do that. Okay, that's my hot take. Let's get into the nitty gritty of what we're talking about today. So the Twilight bark today is, when should I spay and neuter my dog and my cat, and why? And I know a lot of you want the answer to this. And like a lot of the things we've been talking about lately, there is no very clear answer. But like I said, when I talked to you about food and prevention last week, I want to help you as a pet owner in 2025, especially in the United States of America, wade through the noise. There's a lot of noise about this topic too. There are a lot of people on the internet giving you their opinion. It's not just veterinarians. It's not just veterinary technicians. It is just pet influencers. So people who have followings who just have animals, people who call themselves, certified pet health coach. I think that's the new crazy fad that doesn't mean anything. If someone says they're a certified pet health coach, I would ask them, what does that mean? What kind of education do they have? Breeders like to talk about this, and then anybody else who works in any other part of the animal industry, as a lot of them are going to have an opinion about this. And some of those opinions are perfectly valid, but some of them are wrong. And so it's important for you to know who to listen to, per usual. Think about the source of who's giving you this information and why are they saying it and what are their sources. So this is definitely a challenge for pet owners out there figuring out when to spay and neuter. And if you don't know the difference between spay and neuter, we're going to quickly go through that. So female dogs and cats are spayed and male dogs and cats are neutered. A spay is the kind of layman's term for an ovariohysterectomy. So that is the removal of a dog or cat's ovaries and their uterus. So dogs and cats in normal anatomy have 2 ovaries, and they have a uterus that is kind of a Y shape. So there are tubes that connect the main body of the uterus to each ovary. So it kind of makes a Y. And right now in the United States of America, when we spay a female dog, in most cases, we're going to take both ovaries and all of the uterus just down to before we get to the cervix. So that is what a spay is in your dog or your cat. The procedure is very similar in dogs and cats, and it's, pretty much the same. Some of the technique can be a little bit different, and depending on the size of your dog, that surgery can be a little bit more extensive. And as far as like when that happens, how old they are they in heat or not, can change how long that takes and what recovery is like. But in general, cats and dogs of all sizes are going to have a small abdominal incision just right in the middle of their abdomen. We do open their entire abdomen. We go into their abdominal cavity to spay them. The ovaries sit kind of close to the kidneys, and then the uterus runs sort of through the mid-abdomen down towards the bladder. And so that's what we do in that surgery. It's a very serious surgery. It's a very involved surgery. It requires a lot of knowledge of anatomy. The doctor who is performing that surgery has to know what the ovaries look like and what the uterus looks like and how to tell that apart from a lot of other really important structures that we don't want to cut out of your dog or your cat's abdomen. They have to know how to identify the vessels and different ligaments that hold those structures there. They have to know how to safely remove them without causing bleeding and hemorrhage. And they have to know how to avoid damaging any other organs in their abdomen. And then they have to know how to close their abdomen properly. We close their abdomen usually in 3 layers. And that includes the subcu and the skin. So all the tissues from the inside out usually is about 3 layers in dogs, sometimes 2 in cats. And yeah, it's a big deal. People who don't really who don't work in medicine and don't know what a spay actually is. Maybe I feel like sometimes pet owners don't really have a visual of how serious that surgery is, but it's a big deal, and it's scary for vets when they first get into practice because it is a big deal and there's a lot that can go wrong. So yeah, spay is a big deal, but it's a surgery that we do a lot. It's probably what we do the most between spays and neuters. And neuters we do a lot as well. Neuters in dogs and cats are more different than between spays in dogs and cats. So in dogs, there's a couple different ways to perform a neuter. In dogs, we're making an incision either just in front or at the level of the scrotum. We're removing each testicle individually, and then we tie that off to prevent bleeding because there are big vessels that run through the cords or next to the cords of the testicles, and then those incisions are usually closed. In cats, it's a little bit different. It's a little bit more simple. We do usually make 2 incisions, one over each side of the scrotum. We remove those testicles, and we can do what's called an auto ligation. So we make a knot with the actual cord of the testicle and allow that to go back into the cat. And most of the time, we don't actually close those incisions in cats when we neuter them because they are so small and the tissue is so thin, it's kind of seals back together after we do it. So that's what those surgeries are. If you've ever been curious and you want to hear about what they are, that's what they are. And for a long time, the established time that we should spay and neuter dogs and cats has kind of been the same if you ask anyone in the veterinary medical community. So for many, many years, most vets would tell you to do that around 6 months of age. And in shelter type situations, even younger than that for population control and for just in shelter rescue situations, that is done earlier even now, just to ensure that those pets are not going out into the world unspayed and unneutered so that they cannot reproduce. And the reason for this sort of age, 6 months of age, that was established by the vet community, there were really, really great reasons for that. When that was sort of established, there was concern about population control. Dogs and cats were more free roaming, so more likely to accidentally breed, more likely to have unplanned litters of puppies and kittens. So this was thought to help reduce overpopulation and unwanted pregnancies. It was established because 6 months of age is around the time dogs and cats are going into puberty. And so the thought was this can minimize those hormone-driven behaviors like marking. Dogs and cats can both mark intact males especially. Roaming is a lot more common in intact males. And there was some thought that aggression was more likely to develop in males who were not neutered. There are reproductive diseases that can be prevented by spaying and neutering. So if you've never heard of pyometra, that's a very serious, often life-threatening condition where the uterus becomes infected. This can be what's called a closed pyometra, where the infection is closed off within the uterus, and this disgusting infected fluid can build up and actually make the uterus rupture into the abdomen, and then you have infection in the abdomen, and that's usually a fatal situation, but it makes these dogs very, very, very sick. There are cancers of the ovaries and the testicles that obviously can't happen if those organs are taken out of those dogs and cats. And we do see other issues that have to do with hormones being present as they go through life. Another reason we establish this 6-month timing, especially for spays, is because from the 60s through the 80s, a lot of research started coming out that showed that the incidence of mammary tumors would be greatly reduced when we spay these female dogs at a younger age before they start having heat cycles. So there is research out there. There's a lot of really well-established research that says that dogs who are spayed before their first heat cycle have a really, really low risk of developing mammary or breast cancer. And that risk is still reduced before their second and third heat cycle. Their risk of mammary cancer goes up each heat cycle they go through per the research. And then after, I think it's 2 years of age, there's really no proven benefit as far as mammary cancer goes to spaying. So basically what we took from that research was that our female dogs are going to be really, really unlikely to develop mammary cancer if we go ahead and spay them before 6 months of age. So that combined with all these other known benefits of going ahead and spaying these dogs and cats led us to just generally give that recommendation. And I think this is a great opportunity to just say that in medical communities, medical professionals make the best recommendation that they can with the information that is in front of them. And that is what medical professionals should do. It's what they're obligated to do. It's what's responsible. And in most cases, they do have to rely on what the literature tells them. And so that's what the vet community has done for a very, very long time. It's what I was taught in vet school about 10 to 14 years ago, that we should just go ahead and spay and neuter our pets at 6 months of age, and in some cases sooner if they're in shelter situations. But if you're listening to this, then you probably already realize that the thought process on timing of spay and neuter has started to change. In the last few years, there has been growing research on different hypotheses, different thoughts that there may be some benefit to waiting longer to spay and neuter certain pets. And so this is being talked about. We're now in the age of social media. And so anything that's coming along, newer thought, newer research, it's going to get talked about. And that's what's happening right now. And I personally think that that's a great thing. I think it's great that we're evolving, we're learning more, and we can, go with what the research says. That takes time. The veterinary community has been doing one thing around this subject for a very, very long time. We've been taught this for a long time. This is what we have thought was right for a very long time. It's what we have been doing because we have truly believed is what was best for our patients. And so now we're in this sort of transition phase where we're learning more. There's more research coming out, and we're starting to see that for some of our patients, we need to step back and think more about when we're spaying and neutering them. And I know that you've heard about it. I know that you're talking about it. I know that you want to know more about it. So a lot of what we're talking about right now has to do with a couple of studies. There's a really big study that's sort of been the hallmark of this shift in thought in the actual medical community. And that's a study from UC Davis. So the University of California, Davis has a really great vet school, and they did this huge breed-specific study. So what they did is they took all this data they had about all these patients. They looked at what diseases do they have, different categories of disease, and then they got more information about when were they spayed or neutered, and then they gathered all of that information and basically came to certain conclusions based on all of that data. It's a very cool study. It's not a perfect study because this is all retrospective. So they're just looking at information that they had. There's some factors that can't be taken into account when we do this kind of study, but it does allow us to see some patterns and some connection and help us when we make these decisions moving forward. So the main disease processes that they were looking at in the study were joint issues and cancers. And then they looked at, dogs that had these joint issues like torn ACLs, hip issues, elbow dysplasia. Then they say, these dogs have elbow dysplasia. At what age were they spayed or neutered? And then cancers, lymphoma, hemangiosarcoma, and mast cell tumors are three of the big ones that they looked at. And the reason these diseases were some of the main focus, I think, is because they're very common diseases and in a lot of cases, very devastating diseases, very costly diseases. They can shorten dogs' lifespans, obviously, and they can change their quality of life significantly. So really important things to look at. And so UC Davis study, we're going to get into sort of the nitty-gritty of that study. The other thing that has sort of come out recently is WASAVA, which is an organization that I've talked about before. They have released guidelines on timing of spay and neuter. And in general, the veterinary community respects very greatly what WASAVA has to say about these kinds of things. And so when they came out with guidelines, it's kind of everybody's sort of like paying attention now. Like, okay, we really need to pay attention to this and be talking about this and thinking about this. So WASAVA guidelines are a little bit more broad than the UC Davis conclusions. And so we'll talk about sort of the difference between the two. All right. So based on UC Davis's research, in general, what we now think is that larger dogs, so dog breeds that generally are over 45 to 50 pounds, or mixed breed dogs that are larger than 45, 50 pounds, there probably is some kind of benefit to waiting to spay and neuter them. And then smaller than that, so smaller breed dogs, small to medium breed dogs, dogs under 45, 50 pounds, there probably isn't a significant benefit to waiting to spay and neuter them. And so those previous benefits that we talked about, which were the reason we said we're going to spay and neuter these dogs at 6 months of age, are probably still valid enough to go ahead and do that. And so in general, if you're listening to this and you have a smaller breed dog, there may not be significant benefit to waiting to spay and neuter them. And the reason that a lot of people are great with that if they have small dogs is because, for one, if they have a female dog, if they go ahead and spay them before or at 6 months of age, before they go into a heat cycle, they don't have to deal with their dog going into heat, actively bleeding in their house. A lot of pet owners are glad for that. It also eliminates the risk of them becoming pregnant, and it also eliminates the risk of them developing a pyometra, which is that infection of the uterus that can lead to emergency surgery to actually spay them. So a lot of people with smaller breed, medium-sized dogs under 45 pounds, I will talk to, they're very stressed out about when should they spay them. They think that they should wait to spay and neuter these dogs and go through X amount of heat cycles. And in general, I tell people not to stress too much about that if they have smaller dogs. We really don't have evidence that it's going to be that helpful to wait. And so if you have a small dog, or if you rescued a small dog who is spayed or neutered at a young age, I wouldn't stress out about that too much. It's going to be fine. And I think it's totally reasonable for vets to be recommending that they be spayed and neutered at a young age, like 6 months, which is what I generally do. Okay, so the moral of the story, if you have a smaller breed dog, is that this probably isn't something to stress too much about right now based on what we know. With very few exceptions, smaller dogs, we really are not seeing a benefit to waiting longer than the established 6 months to spay and neuter them. I think for me personally, with my clients, if they have a female dog, I talk to them about, here's what it looks like for your dog to go into heat. They're going to actively bleed. A lot of people don't want that to happen in their house. And we kind of weigh the benefits, any risk. And a lot of times people just want to go ahead and have them spayed around 6 months. And I think that is totally fine. And again, in rescue shelter situations, these dogs are getting spayed and neutered at a young age. And that is for really good reasons. And it's, a necessary thing for our shelter crisis situation. And so I try to impress upon people not to stress too much about if they have smaller dogs. This really doesn't apply to them yet. If the research changes, our opinion will change. But right now, basically dogs that are, 45 pounds and less, we're not too worried about changing the timing of spay and neuter. So for our bigger dogs, it gets a little bit more complicated. And there's a difference when I'm talking to my clients about a female dog versus a male dog. And I'll just tell you right now, in male large breed dogs, so greater than 45, 50 pounds, I am absolutely chatting with my clients if they have an intact male dog who's going to be big when they mature. I am definitely talking to them about waiting at least until after a year of age to neuter them. And in a lot of situations, we're talking about 18 to 24 months as the time frame that we neuter them. Now, there are important things to consider when we're thinking about this. We talk about possible behaviors that could be an issue if we're not neutering them. There is some research that shows that there are some behavioral benefits to waiting these dogs as well, on the flip side of that. Aggression is something that we worry about and that we want to pay close attention to. We definitely, I have clients who are worried about their male dogs marking, so peeing on things. And so that's something that we can watch for. And then if we have a dog who seems to be, if they're intact, a male dog, and they seem to be wanting to roam, they're more likely to run away. That makes them more likely to get hit by a car. It also makes them more likely to impregnate another dog. And so these are all things that I talk about with my clients, things that we want to be responsible about. These are the reasons why shelter and rescue situations are going to go ahead and neuter these dogs. But if you own a male dog who's intact and you're able to keep them safe and wait until 12, 18, 24 months, in general, for these bigger dogs, kind of over 50-ish pounds, that's what my clients and I are deciding together, is that we're going to wait to neuter them. The other interesting thing is that if you look at research about the incidence of mammary cancer, because remember, for our female dogs, we know there is some benefit in spaying them earlier by like 6 months before they start going into heat. As far as mammary cancer goes, we know that can significantly decrease their risk of mammary cancer. But what's interesting is that a lot of the dogs who in the UC Davis study, and we already knew, are more prone to these joint diseases and cancers, like Labrador retrievers, golden retrievers, boxers, German shepherds, some of these breeds, their incidence or their risk of having mammary cancer is actually smaller than a lot of small breed dogs. And so this actually kind of makes sense. So our smaller breed dogs are, in general, the dogs that are more likely to develop mammary cancers, but they're also the dogs who don't benefit as much from waiting to spay them. And so if you have a small breed, let's say terrier female dog, I would absolutely go ahead and spay that dog at a younger age, between 6 to 8 months probably, because we're going to get the benefit of preventing mammary cancer. And waiting longer, per the research, isn't really going to help us as far as joint disease, cancers, things like that. So the prevention or decreased risk of those issues like joint disease and cancers are really going to help when we have these bigger breed dogs that are more prone to those issues, which I'm saying it, and now that sounds logical, but I think it's important to realize that all of these factors are a bit nuanced, and it is important that we think about these. There's no real rules, right? We think about these guidelines in light of what breed and what size dog we're talking about and what kinds of diseases they're more prone to developing. So, like I said, mammary cancer risk, the dog breeds that are more likely to develop mammary cancers, there are several, but dachshunds are what we think about. Dachshunds, small poodles, Yorkshire Terriers, Yorkies definitely develop mammary tumors very commonly. Small terrier breeds, Cocker Spaniels and Springer Spaniels are actually a couple of breeds that are more prone. They're not always so small. And then some bigger breeds, like I said, Golden Retrievers, Shepherds, boxers have lower risk of mammary cancer. So again, those factors help us decide how important is it actually to spay them before or by 6 months of age. So when we look at the UC Davis study, there are a lot of breeds that are individually listed in the study. They actually make a whole table of guidelines of when to spay and neuter these dogs. So if you have a purebred dog and you're really curious about what does the UC Davis study say about my dog breed, you can literally look at it. So you can search for this study on your phone. We'll put the study info in our show notes for this episode, but there are a lot of breeds that are listed. So basically the study table tells you should wait to spay them until this age or later, or it'll say 6 months, meaning you can basically spay or neuter them at 6 months. It probably doesn't help to wait any longer. And there are some breeds who are exceptions to this general rule of big dogs, you can wait to spay and neuter them. Small dogs, you really don't need to wait to spay and neuter them, and it may benefit to go ahead and spay and neuter them. Vizsla is one of the breeds. So Vizslas is a dog breed who you can have some smaller Vizslas who are very medium sized. They might be less than 45 pounds, but this study does show a very strong connection between increased cancers and earlier age of neuter. And so if you have a Vizsla, I would definitely be talking to your vet about when would be the best time to spay or neuter them, and they may want to talk to you about waiting to do that. Another breed that may have a connection between some cancers and timing early spay neuter is the Cavalier King Charles Spaniel. This is something I learned when reading the UC Davis study. And so this is just another breed where you may want to be having a conversation with your vet about, hey, for my Cavalier male, what age do you think we should be neutering him? And, again, if your vet isn't learning about this yet, that some of you are going to come across that because a lot of this is newer information. It's something you can all learn more about. You can talk with your vet. You can find a vet who's more familiar with this information and who is more open to talking to you about alternative timing. And, the Australian Shepherd, that's another one to look at. They do have guidelines that are different for males versus females. So what's interesting in the Australian Shepherd, per the UC Davis study, in males, it definitely says it would be beneficial to wait till closer to a year to neuter them. But in females, there actually may be a benefit to spaying them earlier. So lots of information in this study. And again, this study is not a textbook. This isn't black and white information. This isn't Bible. This doesn't mean this is absolutely what you should or shouldn't do. It's just an opinion based on research and study, but it is a very large group of dogs that they looked at. And I think it's definitely worth thinking about having a conversation with your vet about. So when I am talking to clients, basically what I do, first of all, we're going to look at the breed of the dog, the sex of the dog. So males and females, different conversations, right? Because in males, I'm generally a lot more open to waiting to neuter them because we don't even have to have that mammary cancer conversation. So as long as behaviorally and issues with roaming or getting other dogs pregnant, as long as we don't have an intact female and an intact male in the same house, I'm definitely chatting with a lot of owners about waiting to neuter their dogs. If they're male dogs, if they come to me while we're seeing a puppy and they're concerned about it and they have a small breed male dog and they're like, we really just want to wait because of all this information that's coming out, I talk to them about, hey, the research probably doesn't tell us that there's a benefit to waiting for your small breed male dog. But if you would be more comfortable because you think maybe that information is going to come out later, as long as we can keep your dog and dogs around them safe, totally fine with that in a lot of situations. And then in our females, if we're talking about a smaller breed dog, I'm definitely talking to owners about the mammary cancer issue, about how we have to kind of weigh the different risks. For me personally, my recommendation right now for smaller female dogs is to go ahead and spay them around 6 months. Not usually earlier than 6 months if they're not in a rescue or shelter situation. So 6 months. And then when we get into that medium-sized dog or bigger dog, we definitely talk about balancing, having a heat cycle, maybe not going into a second heat cycle because we want to get some mammary cancer protection benefit, again, depending on the breed. So I have a lot of female larger dog patients who are going through one heat cycle and we're spaying them between their first and their second heat cycle. In some of these bigger breed dogs, I tell owners, the age at which these dogs go into heat is different for every dog. Some of them go into heat right at 6 months of age. Some of them don't even go into heat until they're more like a year old. And so we sometimes get into a sweet spot where I'll have a bigger breed dog who's a female and she doesn't actually go into heat until she's around a year old. And so then we spay her after that. And then it ends up being, 12, 13 months 12, 13, 14, sometimes 15 months that we spay them, and we get some of both benefits. I hope that makes sense. And so we kind of get a little bit of the best of both worlds. But again, these are conversations I'm having with my clients. Nobody has to be stressed about it. We talk about it. We talk about options. And basically, I tell clients, here's the information. Here's what we know right now. This may change in the next 5 years again, but we're going to make the best decision we can make with the information that's in front of us. And we're not going to stress too much about it, because this is another thing. This is kind of what I talked about when I talked about pet food. Timing of spay and neuter is something that people are really stressed out about right now, really stressed. And I hear a lot of people tell me they feel a lot of dread and guilt because they've adopted a dog who was spayed or neutered at a young age, and are constantly worried about what that means. And so, yes, it is important that we think about these things. And yes, when we have the ability to control the timing of spay and neuter for our dogs and our cats, yes, that is important. But again, this isn't the only important part of their health. This isn't necessarily the most important decision that you'll make for them. There are so many other things that you can do that will ensure that they're healthy for the rest of their life, regardless of when they were spayed or neutered. Something we're talking about a lot in these dogs is joint disease. And yes, timing of spay and neuter, we know now, can sometimes affect joint disease and joint health, but we still know that there are other things that are even more important. And the most important thing we can be doing to keep our dogs' joints healthy is keeping them at a healthy weight. The same goes for our cats. We have so many pets that are overweight and obese, and this is so hard on their joints. And so, if I have a client who has an overweight dog, who has a body condition score of 8 out of 9, and they're just really stressed about when we spayed them or when we neutered them, I'm going to say, hey, we have a way more important fish to fry right now, and that's getting your dog to a healthy weight. And so this is just, again, big picture. Yes, this is an important thing to talk about, but there are other equally, if not more important things to focus on. So if you've adopted a dog that got spayed or neutered, and as a very young puppy or kitten, please don't stress about that. We can't go back and change that. That was done for all of the right reasons. And, if we can ever solve our shelter overpopulation and crisis situation, then yeah, we can have a new conversation about when we spay and neuter those dogs. But right now, people who work in shelters and rescues, they're just trying to keep their head above water. They're trying to keep puppies and kittens from just continuing to be churned out. And so that's why they're spaying and neutering at young ages, and it's okay. And it's what has to be done right now. I haven't talked about cats yet. I'm going to talk about cats. So in cats, we really don't have convincing evidence that there's really any compelling reason to wait longer than 6 months to spay and neuter our cats. So if that changes, I will let you know. But in general, there's really not any cats, male or female, that I recommend waiting longer than 6 to 8 months to spay or neuter them. We definitely can have behavioral issues in dogs in male and female cats. The way cats behave and the way that their reproduction is a bit different from dogs. So female cats can go into heat very frequently. In dogs, it's usually about every 6 months that they'll have a heat cycle. In cats, this can happen sort of spontaneously, and it can happen over and over again. And so female cats can act really funny when they're in heat, and male cats definitely will wander. They definitely can be more aggressive. They definitely will mark in your house when they're intact. And so right now, as a general consensus, the veterinary community is saying we're not changing our recommendation of when we spay and neuter our cats. Could that change? Sure. But I think for right now, we are sticking to the about 6-month rule, and earlier even in our cats. So if you have a cat, nothing right now as far as the general vet community has changed. We're still fixing them around 6 months, if not sooner, especially again in rescue shelter situations. So no need for you to stress. So you're getting off easy right now. Something else I wanted to cover in this episode was there's a lot of talk right now about ovary sparing or testicle sparing spays and neuters. So there are some alternative surgeries being done to prevent pregnancies, but maintain the hormone-producing organs in female and male dogs. So ovary-sparing spays, you've probably heard of this. If you haven't, it is something that's happening more in the in the vet world. So there are more and more veterinarians and veterinary surgeries who are doing ovary sparing spays. So they're just taking the uterus when they spay them. And there is growing research about this. What are the benefits of this? What are the risks of this? People get concerned about the hormones that are produced by the ovaries continuing to cause a possible issues with the part of the uterus that's left after the surgery. There is definitely some research that shows that's not an issue. And so I think this is something that's going to continue to grow in popularity. We're going to maybe learn more benefits from it. And so my prediction is that in the next 5 to 10 years, we're going to see a lot more ovary sparing spays in the US. I know this is happening more in other countries. And I do have a couple veterinary friends who are already doing this. And so this is something to watch out for. We do know that sometimes with hormone shifts, when we take all of the female reproductive organs, can lead to some issues like incontinence. So in females, they can have hormone-related after spay incontinence where they will actually pee in their sleep. And so we do think that there could be some benefit there with this. And in males, the vasectomy procedure is actually being done in males. So their sperm duct is actually blocked, but they keep their testicles. So they keep their testosterone-producing hormone hormone or testosterone producing organs, their testicles, but we take away the ability for them to actually impregnate other dogs. So these are preventing the population issue while preserving hormone production. And there are definitely some people and groups who think that there's a lot of benefit to this. So if you've heard about this, yes, this is a growing thing. It's starting to grow in the US. There are definitely countries in other parts of the world. Europe is one that I know where these procedures are being done more and more. And so a lot of things like this often happen there first, and then the US kind of catches up. So again, I think these things are going to grow in popularity. If you're interested in that, it's definitely something to chat with your vet about, see if they're comfortable doing them. If they're not, they can potentially help you find a surgeon or a veterinarian somewhere who is comfortable doing them. Do I think that it's what you should all be doing right now? No, I don't. But I definitely think if you're interested in it, you want to learn more about your options, it's something worth chatting with your vet. And, the whole idea of waiting to neuter or spay these dogs, especially in these large breed dogs who are prone to joint disease, is that we're allowing their joints and their bones to develop, that we allow them to fully go through puberty. We allow them to fully develop. We allow their growth plates to come together and everything to just be mature and developed before we take away that source of hormone. Because we do know that hormones have a lot to do with growth. They have a lot to do with development. Obviously, we know that. It's true in humans as well. And so it does make logical sense that there may be some benefits to letting all of that happen before we remove the source of those hormones. Sorry, y'all. It's been a day. I've talked a lot today at work. So yeah, that's what everybody's talking about. All right. And the answer is there isn't a clear answer. I would say if you have a bigger breed dog over 45 pounds, it's a conversation you should have with your vet. When do you think we should spay or neuter them? If you read about these things and you decide, I want to wait until X time to spay or neuter my dog, in most situations, I do feel that it's okay for you to make that decision. And if you need to find a vet who supports that, then that's what you should do. And, I think veterinarians, we all mean well. And if a veterinarian has a hard time with that decision, honestly, it's because they're worried about your pet and you all just don't have the same sort of philosophy on it. And so, I think there's enough veterinarians now who are aware of these studies and aware of these potential benefits that would definitely work with you and be very comfortable with neutering or spaying your dogs at a later age. I will tell you that if you are going to wait to spay your dog until after they've had at least one heat cycle, what I recommend for my patients is that we definitely wait about 8 weeks after they stop bleeding before we do that spay surgery. I find that recovery in these dogs is a lot more comfortable if they're not in heat or haven't been in heat in a couple of months. Everything around their reproductive tract is just more vascular and friable when they're in heat, or if they've just been in heat or they're about to go into heat. And so I definitely tried to time that surgery right in the middle between their potential heat cycles, which again is about 6 months apart. I do find that patients are more painful after spay surgery if they are in heat or have recently been in heat. And I find that working with the tissues when we're actually doing the physical surgery is a lot more difficult if they're in heat. And so I think that makes it more likely to have complications like bleeding for those dogs who are in heat. So that's my other kind of tidbit advice if you are going to wait until after 1 or 2 heat cycles to spay your female dog. Okay, that's really all I have to say about that. I hope this is helpful and not confusing. It's a complicated topic. There's a lot to it. There's a lot of information out there you can read. WSAVA guidelines on it are very helpful. The UC Davis study most people can go through that paper and understand a lot of what it's saying. Again, there's a chart with information about your dog's breed if you have a purebred dog. And if you don't, if you have a mixed breed dog, if you have a poodle mix, there really is an established age for that. And so bigger ones over 45 pounds may benefit from waiting. Under 45 pounds, we really don't think there's a significant benefit, and they can be spayed and neutered around 6 months old. Okay, that's what I have. You can send me questions. I'm going to do follow-up questions on this topic. So if you want to send me a follow-up question about timing of spay and neuter, you can send that to, you could DM me at Dr. Molly Says. You can DM the podcast page, Dr. Molly Says Pod. You can also click the link in the bio of the podcast page for a submission form for sending us a question. And if you are not following us already, you can subscribe to our YouTube to watch these episodes. Make sure you're following us so you get every new episode wherever you listen to podcasts. Download our episodes, leave us a review if you feel like it, and make sure you're following my Instagram and the Dr. Molly Says Pod Instagram. And this has been another episode of the Dr. Molly Says podcast. I'll see you next week.